Houston State leaders are frustrated about the healthcare on free cancer screenings for residents of the event. Right now, Houston State leaders.
The new report shows there may be a reason behind why minority communities are dealing with higher environmental risks for cancer. More than 56% of the people in minority communities live in toxic environments. Those alarming numbers come from research done by the National Minority Quality Forum and several partner agencies. The findings?
Chemical facilities along that stretch of river, where the EPA has repeatedly found that residents are exposed to more than 10 times the level of health
Cancer
risk.
rates here in his hometown of Flint are soaring. The disease taking the lives of his loved ones.
Very concerning. My aunt passed away. She had 5 different cancers. My cousin passed away. She had 3 different cancers.
What is happening here in Genesee County, and is this cancer crisis connected to the water switch? Newly released data from the health department reveals cancer rates here significantly higher than anywhere else in the state of Michigan.
A documentary telling the story of creosote contamination from a Union Pacific Railroad yard in 5th Ward premiered at the Deluxe Theater today. The railroad yard has long been said to be the cause of the cancer cluster in 5th Ward. The documentary aims to educate the community about the possible danger still lurking in the area and to get community members to sign up for free cancer screening.
To sign up for the screenings.
Okay.
And so these screenings will have a long life for years.
Actually looking at the shifting stages of cancer in someone's body. And so because we know that there's been exposure here in the 5th Ward for such a long period of time, unfortunately, we believe that some of these environmental toxins are changing the molecules and what is happening in people's bodies.
Part of a program that we've launched called Cancer Stage Shifting Initiative. And the idea is to move us from late stage diagnosis of cancer to early stage diagnosis of cancer.
Well, today, an early cancer detection program is set to launch to help families get access to care and the continued efforts to address cancer rates in Houston's 5th Ward.
A new enrollment initiative, and this is truly aimed at trying to help residents in the area. We're talking about everything from screenings, different health screenings, as well as getting access to care. And so people will be able to do that here tonight as well. We've also learned one of Houston City Council members is going to be one of the first patients to enroll in this particular program.
Officials with the National Minority Quality Forum told us they hope the study leads to proactive changes to cancer health care.
We can go back to members of Congress, to the state legislators and say, so here's what quality cancer care actually costs. And our sense is that if we get it at that pre-cancer stage, the cost will come down dramatically.
Get rid of petrol and chemical plants. We're getting rid of it right now. That's my fight.
Good afternoon. I want to, before I introduce our panelists, say just a quick word about the Cancer Stage Shifting Initiative that the National Minority Quality Forum has launched. So what you should gather from the film is that there are communities around the country that have been exposed to environmental toxins. These environmental toxins have raised their risk for cancer. 5th Ward in Houston, Texas, Flint, Michigan, Cancer Alley in Louisiana, Rubbertown in Kentucky. These spots are all over the country. And it's not just that they've been exposed to environmental toxins, they've also not had access to best modern care. There are no clinical trials. They get diagnosed late for cancer. The cancer has metastasized, and their mortality rates are high. So in the Cancer Stage Shifting Initiative program that NMQF has launched, we want to shift them from late stage diagnosis of cancer to early stage diagnosis of cancer, taking advantage of these new early detection screenings that are becoming available. In our partnership, and we're going to hear from Quest Diagnostics in just a minute, we are working with Quest and MD Anderson to really what we think of as surveil the population through these new screenings. So the sense is that changes in blood chemistry signal the onset of cancer about a year or maybe 2 years before the cancer is actually stage 1. And if we can diagnose cancer at that early stage, then the presumption is that we can treat them and obviously reduce the risk for the higher mortality. This is what writing that last chapter on the war and cancer looks like. And we want to make sure that that chapter gets written in these underserved communities. And the very fact that we call them underserved should be an anathema to all of us, right? Because it's saying that we have deliberately left these communities where they are. We're not just collecting clinical data, we're also collecting the financial data because we want to be able to come back to members of Congress and state legislators and cities and say, here's what it costs to actually take care of cancer in these communities. I'm really excited by this panel. Most of them have been with us. We've worked in community together, and we're going about the business of changing healthcare. And I would just add this one thing, which is this is a demonstration project for how we need to deal with healthcare disparities in diabetes and cardiovascular disease, because what we're doing is we're collecting the data, understanding how the disease is presenting at the population level for the community, and then allow researchers and others to come in and learn how to treat these communities more effectively, and also to collect the financial data. So we offer this up as an example, and we'll talk a lot about how we're actually implementing this program in these communities. So let me start off by introducing Julia Larson from Quest Diagnostics, Arthur Woodson from Flint, Michigan, Sharon Lavigne from Louisiana, Mary's Parish in Louisiana, and a deep friend, Councilwoman Letitia Plummer from Houston, Texas. So we're going to, Councilwoman Plummer and myself, and she's a doctor too, but Councilwoman Plummer and myself will do a little tag team and co-moderate this session, because we want to hear from the practitioners like Julia, who's doing things in community, as well as from Arthur and Sharon about their experiences in the community. So let me start off with Arthur and ask him to talk a little bit about the experiences of the community in Flint with cancer.
Well, my name is Arthur Woodson from Flint, Michigan. You all know about the Flint water crisis. Back in 2016, a friend of mine, Pastella, was diagnosed with multiple myeloma, rare blood disease, cancer. So I started speaking with her, and she told me that some other people had multiple myeloma. So being a veteran, I was helping veterans with their benefits. At Count Lejeune, they had TTHM, contaminated water from 1957 to 1985. And multiple myeloma and leukemia is two of the presumptive illnesses from that TTHM. So Flint Water had TTHMs from 2014, April 2014 to October 2015, November 2015. And the advisory letter that EPA sends out is if you consume, bathe, cook, shower with TTHM 30 days, you stand a risk of having cancer. So when she told me that she had multiple myeloma and she said her friend had it, I went and knocked on doors in that area. And just in that one block radius, in that one block, I found 6 to 8 multiple myelomas, which is supposed to be rare. So if it's rare, why am I finding this group of cancer in this one area? So then I started really listening, and I started hearing leukemia, I started hearing T-cell, I started hearing different rare blood diseases that's rare. So I went to the state and asked them could they look into it. They really didn't want to look into it because we already have a lawsuit for the water. The doctors are afraid to even say that it was exacerbated, your illness or the cancer or whatever illness you have was caused by the water, because they working with the elected officials in the state and the city. So I formed a personal relationship with Vice President Harris, and when she got in office, she told me that she would promise that she would come back to Flint and help me with the cancer study. So when she got in office, she sent me over to the White House, which was the cancer moonshot, Dr. Carnival. And Dr. Carnival put me in touch with National Minority Quality Forum. It started off kind of rocky at first, but Dr. Puckrein came through and said, this is what we can do for you. And being that we wanted to, I was asking for a cancer cluster study, and when we started working together, CDC called me down and started asking me questions about the community, different things like that. So we changed the guidelines for cancer cluster study to unusual pattern. Dr. Puckrein brought a whole lot of resources into the community, and that was one of the main things that we were looking for. I was especially looking for it because if I'm out asking you, do you have cancer? I don't just want to hear you say, yes, I have cancer, and then I don't have anything to offer you. I can't send you to somebody for assistance. So we wanted resources at the same time that we are asking people, do they have cancer? And being rare blood disease, Dr. Puckrein also came with some new information because you can't early detect rare blood disease or rare blood cancers, and he found out something new as far as trying to help, early detection, because our cancer was so aggressive. If you diagnosed in January with stage 1, you were either terminal ill or you died in June within 6 months. And that's how this cancer is there. So just one example, an 80-year-old lady named Miss Taylor had cancer. Her doctor couldn't find a treatment that was compatible with her body, I guess. So she called me, and by Dr. Puckrein introducing me to Gentech, I met Yvette Dinkins and Nancy Reed from Gentech. I called them, and they had doctors, and they said, well, then find out if her doctor is willing to work with our doctors. And I called him, he said yes. They found a treatment for her, that was compatible, and now she's cancer-free. A lot of people don't have those type of resources, but if we can, in Flint, lead by example and show people, hey, this is how it should be done, we can spread it out to other areas and bring resources into communities that is less fortunate and have the health disparities that Flint has. Because we have the resources, we have the money, but the money just not getting to the people who should have it. So thank you for giving me that time, Dr. Puckrein.
Sharon, you want to talk a little bit about Louisiana?
Yes, I'm from Louisiana, but it's called Cancer Alley where I'm from. And it's an 85-mile stretch between New Orleans and Baton Rouge. In 2016, I was diagnosed with autoimmune hepatitis. And I don't have cancer, thank God, but a lot of my friends died right there in my community. And I joined an organization in 2015, and I sat there and listened to the people talk about all the industries that's coming in. I live in the 5th district in St. James Parish. We have 7 districts. My district have 12 industries within a 10-mile radius. I didn't know that when I found out in 2018 that we had 12. These chemical plants emit so much carcinogens. People are dying. I've been to the White House telling everybody we need help in Louisiana, especially in Cancer Alley. People are dying, and we're talking to some doctors right now that's trying to help us with early detection, men with prostate cancer. We have, my friend Jean just died with liver cancer. My other friend died with breast cancer. One died with lung cancer. And poor Albert, he's fighting for his life. He has pancreatic cancer. I have 2 brothers with prostate cancer. My sister-in-law died with breast cancer. My sister died with breast cancer. It's all around us, and we need help. I know the problem. You have to get to the root of the problem that's causing these things. In my community, it's the industries. That's why we formed an organization and we called it Rise St. James. Because we see where the problem lies and we see where the root of the problem is. Our parish president said Council Alley is a myth. He's inviting more industry to come in, and we're trying to keep them out. So far, we stopped 3 from coming into the 5th district, where we have 12 already, and they want to put 3 more, that'll be 15. So we blocked those 3. And our councilman is fighting against us, knowing that the pollution is causing us to be sick. Our air is toxic. Go outside, you can't breathe the air. Your children cannot go outside for a long period of time because they'll come back in the house with rashes. Our soil is polluted. If we plant a garden, the soil has arsenic in it and lead in it. The air is so polluted. We have particulate matter 2.5, particulate matter 10. They come in, we did a health study. We're doing a health study right now. I know that in the 5th district, I think the national average is 40% higher in St. James than the national average. And in our neighboring parish, St. John the Baptist Parish, those people are dying like flies. The white sold their homes to the blacks. Blacks are stuck there with Dinka DuPont. And I know y'all heard about that. It was on MSNBC. And we are fighting Formosa Plastics. Our councilman that we have right now, he wants to reaffirm Formosa Plastics. Formosa Plastics cannot get the funding to build this $12 billion industry. We started off at 9.5 in 2018. We held it down. Now he wants to bring it back in, and we're about to vote him out of office. Right. The one before him, he was on our side. He would come to our meetings. He said he didn't want any more industry in St. James Parish, especially in the 5th district. He was behind my back talking to the representatives of Formosa Plastics. He voted for Formosa to come in. Even after he talked with us, we thought he was with us, so we voted him out. He's gone. He can't come back. But we are fighting for our lives. It's a life and death situation. The chemicals are killing us. We have benzene in our drinking water. I've been drinking benzene for all these years. I didn't know we had benzene in our drinking water. That's why the people are dying. We didn't know. I didn't know. I found out when somebody worked at the plant told me how much gallons of benzene was accidentally dumped into the river. And that's our water supply that we drink. And sometimes our body itch when you take a shower. And I didn't know. But knowledge is power. When I started to learn, that's when I started to fight. And I can't stop. I quit teaching because I couldn't teach for 8 hours a day, then come home and work on my organization. But God led me to do what I'm doing. And I know the answer. Get rid of all these polluters that's killing us. And when we talk about it, they tell us, be careful. I can't be careful. My people are dying. I can't be careful. I have to speak it and tell it the problem is the industry. If you got an industry and they want to come into your community and they're going to get an air monitor, they will pollute you. Trust me. We have one right now. It's called GG Fuse. He said he's not going to pollute. My daughter asked him if he's going to get an air permit. He said yes, but I'm not going to emit too much. A little bit is too much because we already have 12. You put all those together, that's too much. So we told him no. You know that he's still trying to come in. I said no. Sorry, you're not coming to St. James. You might come, but you're not coming to St. James. And I told Formosa, you don't know who you're playing with. You're not coming to St. James. We're already overburdened with industry. Now they want to bring Hyundai in. We have information on Hyundai that's right down the street from us. Maybe about a 10-minute ride from my house. I spoke yesterday at a meeting. I was at a meeting yesterday speaking about this, and I'll be at a meeting tomorrow night speaking about this, and I'll be speaking again Thursday. The community called us to ask us to come to their community to speak about all this industry that's trying to come in. It's poor black communities that's begging for help. They're crying out for help. Some of them want to sell their homes, but they're not going to give them enough to rebuild. If they move them out, because it happened already to another community. They came in and bought the people out. The people had to start all over with a house note. I'm not about to start over. My house is already paid for. I'm not about to start over. And my community, I will not leave them there. I can leave right now if I want to, but my family's there. My community's there. He would frown on me if I leave my people there. Poor Albert is dying. He said, Lavigne, I can't come to your meeting because I'm hurting. He said, I have to stay close to the bathroom because the chemo, whatever they're giving him, is making him sick. They help one part of your body, then the other part, it's really bad. Y'all need to come and see where I live. It's really bad. Thank you.
Councilwoman Plummer, you want to talk a little bit about the Fifth Ward so people understand that, and then the program that we've been working on together.
Yes, no, thank you so much for allowing me to be here. So in 2019, the Fifth Ward community was designated by the Texas Department of Health and Human Services as a cancer cluster. And that's one piece I would love to have, more conversations with both of you. I believe that was really helpful for us because when the state comes in and makes that designation, it really kind of creates some credence in terms of what the complaints of the community has. Union Pacific was using creosote, which is a wood preserving agent, since the 1940s. And that creosote had gotten to groundwater, into the soil, et cetera. And many people in this community have cancer. And so fast forward now, lots of work has been done, challenges, not only politically, but with the state as well, because in the state of Texas, and I'm not sure how Louisiana is, but in the state of Texas, and Houston specifically, we don't have the authority to give a permit to a facility that is building something that could be potentially toxic. The city of Houston doesn't have that authority, and so the state does. And so if your state doesn't respect the fact that the cumulative effects of bringing all of these industries in one specific small area, then the city has a hard time fighting it. And that's one of the main reasons why Houston's had such a difficult time. Fast forward, UP, we was asked by the EPA to do additional testing. We just got results recently, and they found that the soil was not toxic enough.
Oh my God.
And so now this community is living in an area where they really can't move because it's not toxic enough to live in that community. And let me just give you a little bit of background about what creosote is. Creosote, as the vapors are released into the ground over time, the creosote gets heavier and heavier, and it's almost like peanut butter. So it kind of keeps on falling deeper and deeper into the earth. And so in the 1940s, the numbers obviously were much higher, right? The vapors were much higher. But now if you go in and test that area, it's not as high as it was before. And so what our challenge has been is, number one, creating the correlation. But number two is, from an environmental justice perspective, what do we do? So now we're at this crossroads, and NMQF comes in. And that's why I'm so in Quest. And so I'm so grateful, and Acclinate, for telling the stories. I'm so grateful for that, because even though people feel as though they don't have any other resources, and they don't or can't move, now they have an opportunity to do early detection cancer screenings with our cancer shifting initiative, stage shifting initiative, to determine early on where they are in the process. And so because of the support of NMQF and Quest and many of the other partners that are here, we have been able to look at the boundaries of what the EPA has designated as a cancer cluster, which is about 200 people, and put them into a screening process, an early detection screening process, and be able to track them for 4 years. It's life-changing for this community. A lot of them want reparations. Unfortunately, we can't do that. But what we can do is we can help them live and be grandmothers to their grandchildren, parents see their kids graduate from college, et cetera. And the other piece, the political piece of it, we continue to work on. But now at least there's access. And so we are also supported by Harris Health. So if people are if they do find a signal, we do have that continuum of care to make sure that they're not left behind and they have the access that they need to be able to ensure that they get the treatment that they need. And so that's what we're doing in Houston. And I'm just so incredibly grateful. Our community is happy and excited. They just feel as if for decades they've been lied to and not been heard, and now they finally feel like they've been heard.
There you go. So Julia, talk a little bit about Quest and the role it's played in the Fifth Ward, because I think it's very instructive. So please.
Sure. So thank you for inviting me. So we're very excited to partner with NMQF on this project as well as in the future with some of your cities as well. So we've been kind of working in the background with NMQF to come up with what would be the appropriate kind of testing to do with these people and these communities and work on how we're going to do that. So I've heard a lot over the day about the challenge of getting into communities. And fortunately, part of Quest has a part of our company called Exam One, which that is what they do. They typically go into people's homes to draw blood or get other kind of specimens. So we were able to coordinate having our Exam One group of phlebotomists and managers come into the area in the Fifth Ward at a local clinic. But we also can do group kinds of events, at churches or barbershops or, things like that as well. So I think we have a mechanism to bring the ability to do this screening into communities rather than people having to travel outside and get into those other areas where there's academic centers typically that are doing their clinical research.
So Quest has done so much in Grace Clinic. Didn't have a phlebotomy chair, and they brought in a phlebotomy chair. They helped them tie into Quantum, the network that Quest has to deliver the trial, the information about lab results, and has really helped bring that practice up so that it can actually do clinical trials. And so NMQF trained the staff at Grace Clinic to do clinical trials. We took them through a whole process. Our staff has worked with them. Councilwoman Plummer has been deeply engaged. I got to ask you to talk a little bit about the door knocking that you did, which was a brilliant idea. But if you could talk a little bit about that.
Absolutely. I think that one thing, we've been having this conversation probably close to 2 years, maybe a year and a half now. But one thing that I was very cautious of was this community's been just, the distrust, the levels of distrust in these communities is insane. And so we wanted to make sure, number one, they knew who was coming. We wanted to make sure that they knew we vetted who was coming, but we needed to touch them where they were. Many people don't have the opportunity to come to a town hall, or they can't come to a city council meeting. So what we decided to do is we decided to knock on their door 4 rounds. And so many volunteers, we had about 10 volunteers, 2 of my team members on my staff at the city council, all day, 8 hours. They literally knocked on doors over and over and over again and let them know this is happening. They brought the QR code to the door. Do you want more information? How can we educate you? How can we explain to you what's going on? And when you do that, when you touch their door and you come to their door and actually have a one-on-one conversation, because healthcare is so personal, but when you have that conversation, and because NMQF trained our volunteers as well, we had a full training of what to say, what not to say, what to commit to, what not to commit to, and where to drive their questions to make sure we get the proper answers. It really made a difference. And so far, we have 200 slots. I think we've got 100 people have gone through the screening process. Maybe about 120 people have gone through the screening process. I think 100 people are either slated to get blood draws. So we're really close. And there's that space of people that have done the screening but haven't gotten have not gotten consented yet. And then there's a number of people that have gotten consented but haven't quite made their appointment yet. Those groups of people I will meet with one-on-one or in a small group setting to explain and educate them a bit more. That one-on-one attention is really important in these spaces because of the level of distress that we're dealing with. And so that's kind of where we are right now, but the project is seamless. It's just really going well. I don't know. I'm just so grateful.
And for those of you who know clinical trials, you need to know that we're talking 30 days since we launched the study and enrolled over 100 people in the study. So that gives you a sense of the community's response to it. Arthur, you've been on a tremendous journey in terms of getting good cancer care in your community. Can you talk a little bit about the access issues and things that people have experienced? So they've got cancer now, and now they need good quality care. Can you talk a little bit about what's going on there?
Oh, man. My aunt and my cousin, her daughter, my aunt's daughter, they lived in the same house, and both died from cancer. One had 5 different types of cancer, you heard me speak on in that clip, and the other one had 3. The care is like at 0. Everywhere is different, and Flint is tremendously different. Being that we were poisoned, 98,000 people was poisoned by the water, and it was elected officials that poisoned us, along with the administration. We have a Flint water crisis lawsuit going on, $650 million that was approved back in August of 2020, and no one has seen a dime of it yet. You have people dying every day. I found an 8-year-old that has breast cancer, and no one seems to be able to help the people in the city of Flint. The politics and the different pastors and cliques and different things on how you have to navigate the community is like chess. You got to know who you can talk to, at what time you can talk to them. The hospitals, which you all know, especially McLaren Hospital, I didn't even know about 340B until Dr. Puckrein called and spoke to me about it. And McLaren and Hurley and Genesis, it was money that was supposed to be used in the community to help the patients. And they was using it to pay CEOs and making profit off of it. No charity work, none whatsoever. In our communities, I said to myself that, you know, we've been marching since 1968, singing "We Shall Overcome," and we haven't overcame anything. And I vowed that my grandkids would not have to march for health care in Flint for something that we could have handled before it even got to them. The fight is real, and it's trying to get people to come together to help. You might not like a delivery, like a lot of people don't like my delivery, but I'm just speaking the truth. And sometimes the truth hurts. And a lot of people that's in position of CEO, doctors, researchers, you haven't seen what I have seen or what I have dealt with. And when we come to you, it's people just like now. I had to fight with my cancer study because people tried to take what it is that I'm trying to do and make it their own. And they start adding things, and then they gotta have a meeting because "the" was in the wrong place. And we're gonna have a meeting on putting "the" in the right place. And then the other 2 people who is in the meeting, don't like where the is, so we got to have another meeting. And before you know it, you have about 100 people dead from cancer because they fighting because the is in the wrong place. So it's all about, I'm an activist. I don't work for elected officials. I don't work for anybody but the people. And you know, I promise God that if he put me in a position to help the people in the city of Flint or help anyone, I'm gonna, you know, do my assignment and work with the resources that I have. And so far, God has directed me in the right way. He has shown me NMQF. He has shown me different doctors, different hospitals. Just been placed people in my path that where there's obstacles, he done brought somebody, I might get mad, I might get upset, I might get frustrated, I might want to give up, but God has took me through something before that storm, so when that storm hit, I'm able to weather that storm and keep it moving. But back in the day, I wasn't able to do that. So I'm a work in progress, but I'm still learning. And I'm glad that I have NMQF and the resources that they have, because I'm able to call them. They might get mad at me because I'm mad. But me and Dr. Puckrein, we done talked a lot. And he know me, he'll listen to me and say it's gonna be all right. And you know, he bring his resources, health fairs, and different things like that. And that's what we need. And we need hospitals, we need oncologists, we need doctors, we need quests, we need, in those communities, we need everything, because so many years they said black people are prone to have cancer more than whites, but I never really understood it until I came to a summit here at NMQF and they had a panel. And I asked them, I said, can environmental injustices change the DNA or the makeup and make it look like it's passed down generational and make it look like we are just prone to cancer, not telling us the other part that the environment played a major role in black people being more prone to having cancer than whites. So, and he said, yeah. So I've just been learning every year with NMQF and different things in the community. And I thank NMQF and I thank everyone that works with NMQF for helping us here, there in Flint. Thank you so much.
Yeah, please.
I have a question.
Please.
So this will go to both of you. Let's speak this into existence. NMQF is going to come in, Quest is going to partner in. We're going to be able to have a clinic there. What do you believe the barriers will be, if any, to get your residents to believe in what we're doing and to come and agree to be a part of the screening process? Do you think that they would be excited to see that, or do you feel like there's too much mistrust still? And what do you think the barriers would be?
I think it would be our parish president and our elected officials, because they will try to convince the residents that cancer is a myth. And some of the people, maybe half of our community, would think that the politicians are right. But we have to continue to still fight to bring them the information, to educate them. The more we educate, the more come over to our side and say, you know, I see what you're talking about now. Education is the first thing. But to get through our parish president, you will not be successful. And our politicians either. So you have to go through the citizens.
Being that since 2016 I've been speaking about cancer, and in Flint, like I said, the water crisis, we have self-taught ourselves, you know, for certain wording, TTHM, PFAS, lead, benzene, vinyl chloride. We know all these. We are self-scientists. So it's certain wording. If you say we're coming in for clinical trials, it can't be anybody new. It has to be somebody who they actually trust. And that's where a lot of people have messed up at. And you get them in the city, that grassroots, that person that the boots on the ground, get you inside that city, and then you throw them to the side, then you start working with the people in that city is against. And once you start working with them, that's when the people say, hey, you know what? Y'all full of mess. We're not participating. We're not going to work with you because we saw how you just did the person that I trust. Then you have the people that's already in that city that's stealing, corrupt, or taking the money. You have them, they don't want you in that city because you get ready to take the money that they should be getting. So they're going to buck you, they're going to fight you, they're going to say, hey, you got to go because you get ready to start tapping into funding that we have. So if you don't have that, it's basically like protection. A lot of people think that the money is the power, the people is the power. Before you come into any city, you have to have the people. If you got people that have the people backing them, that they trust, everything is great. We gave a health fair, what was that? January 2023. 2023.
Well,
And I think we had about 500-700 people at that health fair. And we did it in like 2 weeks because the commissioner died, who was going to open up the event and everything. He passed away right before Christmas. So Ajwa and myself, and I forgot the other young lady that worked for NMQF at the time, we had from January the 3rd until January the 16th, Martin Luther King's birthday. Being that they trusted me, I was able to really speak to them, and people actually showed up. It's about operating with people that the people trust. But you do that, you know, everything is okay. But if you come in there thinking that, you know, we're gonna do it a certain way, we're gonna do it my way, and that's it, you're gonna have some serious issues.
No, I totally agree. I think having trusted partners and trusted voices in the community is paramount.
Julia, you know, I'm sorry, I didn't ask you this question earlier, but I just assume everybody knows Quest Diagnostics, so can you tell a little bit about Quest Diagnostics and the great work that it's done?
So there's two major laboratories in the United States, Quest Diagnostics and LabCorp, so you've probably heard of one or the other. We test blood every day on about half the Americans in the country. We have 2,200 what we call patient service centers around the country, and that's typically in communities where patients can go and get their blood drawn there. We have several different labs around the country in the regions that perform all the testing. I happen to be associated with the one in California and Southern California that does a lot of esoteric testing. So even if all tests are not performed at a particular region of the country, we have a fleet of planes that'll get that blood sample from one place to the other to get the testing done, especially if it's specialized testing. So we're just excited to be able to partner with you all, especially with the Exam One. I think that's really what makes this work, is that we do have this access to hundreds of phlebotomists across the country that can go where the need is, and we have been involved in health fairs many times. So I think that's what's really unique about this, is that we have the ability to be flexible on where we go and when, and meet the needs of whatever the situation is.
And Quest also has a tremendous scientific group that has helped us as we've been looking at, so what data should we be collecting? Mm-hmm. What tube should that data be collected in? It turns out to be a very important question, how that blood gets processed. So Quest has been incredibly important, helping to design the study and making sure that as we're collecting those blood samples, that they're actually valuable, that we can actually use them in a scientific way. And besides the lab data that we're collecting, we're also collecting genomic data and electronic health data, and Quest has been just absolutely fabulous. As any of you who've done clinical trials know, there's a lot of hand-holding and a lot of very particular things because we also have an IRB board, and if we violate anything, we've got to report it to the IRB, and we don't want to do that. And so we've been very, very careful as we've been putting all of this work together. And in just a second, I'm going to open up the mics and allow you folks here to ask some questions. But here's what I want you to understand as you start to move forward to ask questions. The reason why we wanted to do this panel with you, because there are communities around the country that need your help. And one of the things that confounds me every day is that we are a civil society. We help our neighbors. We don't allow them to live in carcinogens, and we don't turn our backs on them as they die from cancer. That's unconscionable. How can you call yourself a civil society when you don't even, and some of these industries are literally across the street. They literally across the street, right? And they haven't opened their doors to come out and say, how can we help? What can we do? And so what we're trying to do here, besides the work that we're doing in these cities around the country, is to create a demonstration model to say, so if we're really serious about eliminating healthcare inequities, it's a process. It's a process that we need to understand and follow. And Dr. Plummer, I keep calling him Dr. Plummer, said to us, we should write all this up. And I said, oh, that's a brilliant idea. An implementation study to help folks understand how to do this. And so our team is working with Dr. Plummer to do just that, to begin to put this down on a piece of paper. Because again, by 2050, we don't want to deal with this anymore. We got to put a stake in the ground someplace, right? And we could say by 2050, we can read about Cancer Alley in a textbook, in a history book, but it's not going to be the practical living experience as long as God gives breath in these bodies to make it work. And so that's our deep commitment. So please, if you've got some questions, please step forward and ask, and we'll try to get the answer.
If I could say one thing, I'm going to make my ask as well. One of the reasons why Houston, there's so many reasons why Houston has been successful thus far, but one of them is partners like everyone in this room. It gives us validity. When they see Quest logo at the bottom, or when they see NMQF, they know, or if they know that this is an IRB certified, and this is something that we have vetted and we have done the right way, and when we explain what that means, it's another level of trust that we're able to give to community. And so having you all as a partner, we're just touching the surface here. But what if someone gets a signal? What if we get a positive signal on one of our residents? What do we do with them next? If they're, if they're an African American, is anyone in this room, do you have a clinical trial that our resident can now get inside of and get into? Can we make sure that the fees are nominal? Can you support that? These are the next steps. This is why everyone in this room is so critical to be a part of this conversation. And in that way, by 2050, we can definitely say that we've done our job and that we've accomplished this.
Great. Please.
Thank you. Carla Alvarado with the AAMC Center for Health Justice. And I had a question for each of the speakers. So for Julia, is there a population-based database that Quest has, given that it has the diagnostic data for an amplitude of chronic disease and acute and contagious disease? And then for Letitia is, what prompted you to pursue representing the people? Because we need more people who are trained in health to take political action. And then to the two speakers, Mr. Woodson and Ms. Lavigne, can you tell us a little bit about how you convince people to share data with you, to share their life, just because trust is going to be so important moving forward when we talk about data collection efforts, especially since they're being suppressed across the nation. So thank you.
So I guess I'll answer first. So yes, we definitely do population health studies. Of course, we can use our database as long as everything's de-identified, but certainly for any particular areas of interest, we certainly have the mechanism to do those kinds of analyses. One thing I forgot to mention too is for those of you that are in clinical research, we also have experience drawing samples that we may not test, but we're drawing them for you, for your research purposes. So just know that that's another service that we can offer if that's something of interest to you.
Dr. Plummer?
So I'm an a large member for the city of Houston, which means I am actually like a mini mayor. I mean, I cover the entire city, just under 3 million people. Honestly, I believe because I've got that medical background, all of my initiatives have been quality of life issues. The cancer cluster in Fifth Ward, my dad grew up in Fifth Ward, and so it's something that I've heard about since I was a child. And so I think that all the stars aligned in a way that I'm really not a politician. I'm a doctor, dentist, that's a politician. So I always come from that first position of first do no harm, and that oath that I took. And so I think that I'm probably a unicorn in a lot of ways. I think that it inspires, though, my colleagues on council now understand the importance of it and why it's important to do this work and to look at healthcare and not think that just because you're an elected official doesn't mean that you can't touch healthcare. And so I think we just have to start the conversation. But that's a little bit about why I feel like it's incredibly important. And I think as politicians, we kind of fall in this box sometimes. But as a scientist, I'm always looking for a solution. It's kind of how our brains work, right? And so what I'm hoping to do is just get more elected officials to understand there's not a money bag at the end of the rainbow here. There's no financial resource here. We take an oath to do the best for our communities, and that's what we're supposed to do. And it's our job to reach out and find partners in different places that may not that have the solution for a problem that we see.
Sharon?
I wish I could say the same thing for St. James. We don't have that. Our politicians are in the pockets of industry. We have to do the work. We have Columbia University that's funding us with finances to do urine samples. And so we're getting ready to start that in May. And just like I said, we have the doctors from New Orleans. They happened to see us when President Biden came to New Orleans to Tulane for the hot shot, whatever it was called. And they saw us and they asked us if they can help us and get the community together and talk to them about doing blood samples. And they're the one that's getting it started, and we are presented to the community. But our politicians, not one help us, not one. And the ministers don't help us either. We have one named Father Vincent Dufresne. He came, we went to meet with him, and he's on our side. He's helping us. We have one minister that comes to our meeting, Reverend Samuel Jones. The rest of them, they're in the pockets of industry. They don't care. They don't care if we die. They don't care. They want more industry to come in so they can fill their pockets. The people is nothing to them. Their families are nothing to them. So we have to do it ourselves. So when the people that's sick, they come to us and tell us their problems, and they ask us for help. And we're doing the best that we can. Thank you.
Arthur?
I have fun doing what I do because I get to make politicians mad. I make a lot of people mad, man. It makes my day. That's why I was a telemarketer, because I got to call people early in the morning and make them mad. My fault, I'm sorry. But no, I seriously have fun doing it because, you know, people in our community is suffering and they are not having good days. So every day that I can make one of them mad, I mean, I smile with joy. I learned their game. Their game is documentation, not emotions. And when I learned their game, I started using Republicans against Democrats, Democrats against Republicans, because that's what they do with us. And if it doesn't work, they use the nuclear bomb, which is the race issue. So I went and got the militia and the Nation of Islam to come together, and I took both of them down to the state capitol with me. So all these people are on my Facebook page, and the state trooper, she was the post commander, and she said, "Art, I hate your Facebook page." I said, "Why, LT?" She said, "Because you make people mad." And I said, "Well, do what I ask and you won't have to worry about it."
That's right.
So they fear my Facebook page. So when I found that out, I started, doing things on Facebook, like sending subliminal messages to them. So NMQF was a pot of gold to me. I mean, because they got a lot of stuff, especially data. So not only cancer do we have a problem or issue with cancer, we have a problem with kidneys and cardiovascular, because they use orthophosphates to recoat our pipes from where the lead was leaching. ATSDR found out that orthophosphate, excessive amount, which we have in our food, drinks, and everything else, can cause kidney disease and cardiovascular disease. Our numbers are 3 times higher than the state, and 2, I think, higher than the nation. So what I did, since everybody likes to be data-driven, I called NMQF, Caroline, and I said, "Caroline, you in data for NMQF, I know you can get this information. I need numbers for kidney disease in Flint." Man, he did it so quick, I was like, "Oh man, that's great." So I had a meeting with MDHHS directors. I went down to Larson with this data that Caroline had given me. They looked at it, they got to whispering and looking and doing all kinds of stuff. "Oh, we're gonna have your information, they had American Kidney Society. They had the CEO call me, and we all did a Zoom with MDHHS. Everybody's wondering, man, how are you able to get these directors and all these different politicians to move? Things has changed. The fight has changed. It's no more sitting down at the table where you used to could shake hands and things was done that way. But now you really have to actually fight for what it is that you need. And I'm not the type, if you call me in, that means that you done already went to the table and tried to compromise and you done tried to talk. And I'm more of the bulldog that's gonna come in and just take everything because we done already tried to talk to you. And that's how, what you were saying, the elected officials, the pastors, they're looking for campaign contributions when we're looking for help. And I got a chemical company shut down with EPA just, 2 years ago, that was contaminating our water when we was on Flint River water. So now they going to court right now because he has 20 to 30 something charges for contaminating the Flint River. Things can be done, but it's a certain way of doing it, and using data and fighting their way, their game is how you do it.
That's right. I believe there's a question over here.
Yes, thank you. Camille Campbell from Acclinate. Thank you all for this great panel, and thank y'all so much for sharing your stories in Flint and in St. James Parish. My question is for the entire panel, but maybe more so for Dr. Puckrein and for Councilwoman Plummer. So in our current environment, those people at agencies like the EPA or the CDC who would suss out these clusters where they haven't been identified already have been fired, terminated, let go. A lot of resources at that level are being taken away because they focus on environmental justice and, DEI and things that have been weaponized. And so I'm curious, what are your recommendations for us in the room, besides the way we're, currently partnering, but how can we mitigate that, for the clusters and whatnot that haven't been identified already, and there's not enough staff to go out and do the work to identify them? What do we do?
So just quickly, can you talk a little bit about what Acclinate did in Houston? And we'll get the link out so folks can see, but why don't you tell a little bit about your film?
Sure. So, Acclinate, we have a community engagement platform called Now Included, and through that platform, what we did is we partnered with NMQF and Councilwoman Plummer and those in the Fifth Ward to allow the patients and the community members who are experiencing this to share their stories. And we created a documentary. It's about an hour long, and we have some QR codes if you like to scan and watch, but it's very powerful. But we know the power behind patient stories and people being able to speak what they have experienced and show how they're willing to fight for what they feel they need to fight for themselves and for their communities, and we gave a platform for them to be able to do that. So,
Plummer, please.
Yeah, no, thank you. You all doing that documentary for us, I'm telling you stories, and just what you've heard here, you have to know someone in your life that has that experience. It just makes the conversation relatable, and so telling those stories, it was healing for those folks in that community, honestly. So thank you so much to Acclinate for doing that for us. In terms of the federal government, it's time to get local. It's time to get real local, and making sure that your elected, your county officials, in our situation, the state is not even really on our side. It's really the city of Houston. And in our program, I want to be really clear, our program is city supported, but it's not really city driven. I mean, I am a council member, but this didn't have to go to a vote. It didn't have to go to council to be supported on. This is something that we just bogarted this thing. I mean, we just said, listen, we don't need to have pastors involved. Not saying badly about pastors, but we don't need to have all the local officials involved. We don't need the mayor involved. This is about people, and it's people driven. And so I think that's one of the reasons why this has been so successful, is just because we didn't have to get permission from anyone. And I was always very public about that, even to the community. I am your council member, but I'm here as your neighbor. And I think that was also something that kind of allowed them to trust us a bit more. But it's time to get very, very local. And when people in your elected positions are not doing what they're supposed to do, then you get them unelected. It's really, it's really, really true when we say that. And so congratulations on that piece. But I know it's challenging politically because everyone's looking for financial support. But find elected officials also that have a job. Like, I have another job. Like, this is a hobby for me. And so when I don't have to take $30,000 or $15,000 or get a kickback from an industrial company, it allows me to be a lot more authentic and autonomous in terms of the decisions that I make. And so I would say, elect people that have their own resources and their own funding. When you're looking to hire business people, they're really good doctors, and I'm not lawyers, y'all, but but hire people that really are not connected and don't need a kickback. And I think that's another piece of the conversation. But keeping it really hyper-local in this space, and finding nonprofits and amazing partners like Quest, and then our community that come out and tell stories like they did on the documentary. This is multifaceted. And then all of you in the room that I know are going to jump in and help us out with the last pieces of this puzzle. I know that's a long answer to that question, but it's definitely multifaceted, but it takes everyone. But start at the ground, your city and your local government, because those are the people you can go to the door and you can knock on the door, or you can come to a council meeting, or you can make an appointment with them and have conversations. And then obviously also your nonprofit advocacy groups. So like Air Alliance is a huge partner of ours. Environmental Justice, a huge partner of ours. We've got those local COCO, another partner of ours. So those local groups that are on the ground, that are doing the work, that can that get the funding from grant funding, et cetera, that can allow us to give the data that we need, and then we go to an NQF, and then now we're talking, so it just kind of keeps on building each other. But right now, we can't worry about the federal government. We've got to take ownership of this thing, and we've got to take it by the reins, or the horns. I'm from Texas, by the horns, and we have to do what we need to do to take care of our communities.
That's right.
So we're about to end, but I want to add just a little bit more context to the story. So there have been a number of other companies that have supported this as well. So when NMQF goes into a community, we just don't show up one day and say we're doing a clinical trial. We go in and we listen and we become part of the community. Because one of the things that constantly gets asked is, are you going to be here for a long time? Are you going to go away? And we have to say, no, we're not going anywhere. We're going to be part of the community. We don't actually live in the community, but we can listen and strengthen the collaborations and the partnerships in the community. So we've had a number of folks and companies that have supported us, and I want to certainly acknowledge Exact Science, Bayer, AstraZeneca, Genentech, Gilead, because when we go into those communities, we do mini clinics and fairs and town hall meetings well before we ever get to any clinical trial or anything like that. And so what we say to them is, we want you to partner with the community. We just don't want you to come in and go away, so they support the local vendors, right? They themselves become integrated in the community. And the reason behind that, and this is the historian in me, and I'll end with one historical story for you. During World War II, one of the things that the American military learned, that at the point of attack, you had to bring your Army, your Navy, your Marine, and your Air Force. And you use that combined energy to overwhelm the problem. And that's what we're saying here. We have to bring combined forces. There's Quest Diagnostic, but there's Exact Science, there's Grail, there's Bayer, there are a lot of capacity with lots of different skill sets. Each of them, we're not saying come out of your comfort zone, we're saying do what you do, but do it in this community, because for God's sake, the people are dying of cancer every day. When you sit and you listen to these stories about people who lost generations to cancer, you have to do something. And so that's the message I would leave you with here. We're going into other places. We're going into Flint. We're going into Louisiana. We're going into Selma. We're going into North Carolina. There's an opportunity for you to make one hell of a difference. And I'm going to tell you, you're going to feel so good about it. And probably to me, and I'll end here, the most amazing thing about it all, the people don't even know you did that for them. They don't even know, and it doesn't matter.
That's right.
But you know what you did. You transformed and saved lives so that parents get to see their child grow, that children end up with grandparents, that we set up the next generation so that they don't have to deal with these problems. I think that's what you're in the business of doing. If you're in the business of healthcare, that's the job. And so I want to thank the panelists. I know that Arthur and Sharon, they're your vanguard. They're on the front line dealing with this every day, listening to those stories. And certainly, Quest Diagnostics has been a fabulous partner. Couldn't ask for anything. They were there not just blood, but helping us understand how we need to go about this and do it in the right way, so that when we come out of this, we actually have a set of data and information that can actually use it. And for Dr. Plummer, she is a state of art. I'm telling you, I've learned so much working with her. If every politician was like her, America would be a very, very different place. And so please join me in thanking the panel. Okay, great.